Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is our usual Thursday update. And today is February the 10th. And for the first time in many months, I think most of the news that we have today is good. And so the good news is that I think we're at the top or a little bit past the Omicron peak, and we're expecting much better things in the next few weeks. So as we always do, we take people's questions, and we have a few good questions today that we'll review, and then we go at the world level and then move our way down to the local level. So if you do have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get to the questions on our Thursday meetings. So looking at the world overall, it looks like the Omicron wave has peaked. It's peaked, I think, in Europe. I think it's peaked in North America. It's still a little questionable in South America and in Africa. I think in Australia, it's at the top. And in Japan, which is starting to see a lot of cases over the last few weeks, still going up. But I think overall, the world is at the top of the Omicron peak and is starting to come down. The good news is that in most of the countries that have peaked have come down quite quickly, although there are a few outliers. I think the UK has come down less steeply, and Denmark, which also has the BA2 variant as well as the BA1 Omicron variant, is seeing still a stubbornly high number of cases and a rising number of hospitalizations. In the US, the East Coast of the United States had this first. And so New York, DC, Atlanta had this first, and they're pretty much done with it. They're not back down to the low levels they saw before Omicron, but they're down quite a bit from their peak. Hospitalizations are down, but still in this country, we're still seeing a lot of deaths, over 2,500 deaths a day. You know, when you put that in perspective of other causes of death, accidents, suicide, homicide, this really is a stunning number of deaths that we continue to have. And while many of the people are older, there are a considerable number of people less than 65 who are dying of this, and that really is an impact upon them and their families and friends. In Oregon, I think we peaked last week and we're coming down. Hospitalizations, which peaked over the weekend, are now also coming down, and that's good. But the number of cases and the number of hospitalizations is still pretty high, over 3,000 cases a day, which, when you think of it, would have been one of our highest counts at any time during the pandemic. Douglas County is also coming down. We're at about 90 cases per 100,000 per day, down from our peak of about 150. We never got above our peak that we had in the Delta, but still pretty high. Our number of hospitalizations have been in the 30s or low 40s. But most of the people who have been hospitalized have been less ill and have been able to be discharged quicker. Fewer of the people we're seeing really sick on ventilators for weeks or months at a time. But nonetheless, we've had quite a few deaths, 17 deaths in the last 2 weeks. And so this is still, although overall less serious than what we saw before, still a pretty serious disease. I mean, we don't see 17 deaths from any other infectious disease. And so to have this many deaths is still hard. And the other thing that we're seeing is that people who are vaccinated are much less likely to be hospitalized or die, and people who are boosted are very much less likely to be hospitalized or die. I calculated the numbers over the last month, and you're 19 times more likely to die if you're not vaccinated as opposed to being boosted. So really, the vaccines are working great to prevent severe disease. Now, because the Omicron variant is so different from the original one, the vaccine has not been perfect at preventing illness. And in fact, many of the cases that I know about in the last few weeks are in people who are vaccinated, even some who are boosted. However, when they get the disease, they just get sick, a cold, flu-like illness, and in a week or so, they're back to good. None of those people who have been hospitalized and boosted that I know have been hospitalized, and certainly none have come close to dying. So again, if you've not had your vaccine, not had your booster, please go ahead and get it, because we think that really will help prevent the severe disease. We have 2 clinics providing those, one at Fowler Street lot across from the Roseburg Public Library, the other one in Reedsport at the county courthouse annex. Both are open from 10 to 5 and have all of the vaccines. So if you haven't had your vaccine, you need your booster, think, oh, I'll get around to it. Today is the day to get around to it. They'll be open till 5 o'clock tonight. please go ahead and get your vaccine or your booster. One of the other questions that's come up this week is about vaccines for littler kids from age 6 months to 4 years. There's talk that the FDA will be considering that in the next few weeks, and it's possible that the vaccines for those 6 months to 4 years will be available later this month. Vaccines in that age group are always controversial, so we'll see what they say. In terms of treatments, there are a couple of treatments that are out there. There's this sotrovimab, which is a monoclonal antibody, which is similar but different from the Regeneron. It does seem to be effective for preventing hospitalizations and death. We do have some doses of that here in the area. So if you get COVID and high risk, you should talk to your doctor about whether you would be a candidate for sotrovimab. In addition, we're beginning to get some of the Paxlovid and the molnupiravir, both of which are oral antiviral agents that you take after you get diagnosed that help to decrease your risk for hospitalization and death. We do have some doses here in the community. So again, if you are in one of the high risk groups, and that would be older, underlying conditions, you should ask your doctor about the possibility of using either Paxlovid, molnupiravir, or sotrovimab. We think that as the number of cases gets down, and we're finding more of the cases, that we're going to be able to go ahead and treat almost everybody with one of these drugs and really decrease the risk of hospitalizations and death. Because if you think of COVID, and if COVID got to the point where for everyone it was a nasty cold, but not much more, we wouldn't worry too much about it. It's only because we've had so many hospitalizations that nearly crippled our hospital system, and so many deaths. We've had about 350 deaths since the beginning of the pandemic. That's a lot of people dying. What we're going to see in Douglas County over these years is the life expectancy is going to decrease, and likely for the first time in many years, our population will decrease. So typically each year, the balance of births and deaths is pretty even, usually a few more births and people moving in than people dying and moving out. So our population has increased by a little bit over each year. But I think this year, we're likely to see our population decrease because of the deaths that we've seen from COVID. So it is an important disease, but if we could decrease the risk of hospitalization and decrease the risk of death, that would be absolutely great. One of the questions that came up is about the use of home tests. So the home tests are out there. I think they work pretty well. And the home tests have three really good uses. The first use is if you have symptoms, think, oh, geez, I might have COVID, but you're not really sick enough to go to the doctor. Perfect to do a home test. If your home test is positive, you've got COVID, no need to go to do the doctor or anything else. The second time the home test would be useful is if you were exposed 5 days later to test, because though if you're negative 5 days later, you probably don't have it. If you're positive, you almost certainly do. And so that's a good time to do it. And then the third time to use home tests, if you're going to do some important high-risk activities. So we did a video earlier this week that's going to be on our site later today, telling you about how to use those tests. I actually do one of the tests on camera so you can see how it works. They work pretty well, but they're not foolproof. But so if you're going to do a high-risk activity, I report on the video like if I was going to visit my 92-year-old mom. I certainly want to be sure I wasn't positive, so I would probably check before I left to go back east and then check again on the day that I was to see her to be sure that I was negative. So I think the home tests are out there. You can get them at the store. The county got 15,000 kits, and we're distributing them through rural fire stations. And then you can get free kits from the federal government at covidtest.gov. So just put that in there. Relatively easy to order, and within a week or two, they'll arrive in the mail. So that's a pretty good thing. Another question that came up is about what people talk about this disease becoming endemic. What does endemic mean? Well, endemic means a disease which is in the population that is neither increasing or decreasing, and that is a level that you can kind of live with. So think about the time before we had chickenpox. Chickenpox was in the population, and every year you would see kids get chickenpox because almost everybody in the U.S. gets chickenpox by the time that they're 20. And so that every day in the pediatric practice, we'd have 1 or 2 or 3 calls about chickenpox. It's a moderately severe disease. Some kids would get hospitalized. We would have an occasional death. but it would be an occasional death and an occasional hospitalization. The disease was not increasing or decreasing. You'd certainly see little waves go through town, but it would never be at a time where school would need to close or hospitals would be overwhelmed or that we'd be having a lot of deaths. So that's what endemic means. And there are a bunch of diseases which are endemic, hundreds of diseases which are endemic, and we follow some of them, but we're not going out and doing the big efforts that we're doing for COVID. COVID is not near the levels that we would need to say it's endemic. First of all, the number of cases is huge, right? So remember when I was saying with chickenpox, we have about 1,000 new babies a year. We'd have about 1,000 cases a year spread out over the time. We're having 1,000 cases a week, so the disease is 50 times more than the endemic rate. So it has to be at a low rate. COVID is still at a very high rate. The second is it doesn't have a huge impact on the healthcare network and doesn't cause a lot of deaths. And again, chickenpox caused a rare death, maybe one every couple of years, and occasional hospitalization. So it didn't really tax the hospital system. And the third would be, for a disease really to be endemic, it shouldn't change very much. So chickenpox doesn't change very much at all. It's a very stable virus. And so that if you look at chickenpox from 100 years ago and chickenpox now, it doesn't vary by more than a few little mutations. Whereas with COVID, there are lots of mutations. So we're not yet at the endemic stage for COVID, but could we get there? Yes. I think if we got more people vaccinated, and we don't see new dangerous variants. Now we will see variants. The question is, are the new variants that are going to be out there dangerous? We know that this disease is in animal populations. We know there are a lot of people in the world who have this, so we know there are going to be variants. But again, most of the variants don't make any difference and they die out. What we worry about is new and worrisome variants. Right now, there's not really one out there. The BA1, the BA2 are like brothers. That have been out there since end of November, but there are no new other variants coming out since then. So we don't have other new nasty variants, and things continue as we will. I think we'll see a decreasing number of cases, and I think over the next year or so we could get to a point where this would indeed be endemic, where we just have a few cases a day. We have good treatments with molnupiravir, Paxlovid, or sotrovimab, so that hospitalizations would be very low and deaths would be rare. So that's the hope as we go on. And that's why when I say that the news these days is mostly good, it's mostly good. One of the other questions that we got this week was about do I really need to get a booster? I mean, I've seen a lot of people out there with mild illness, and you do need to get a booster, because again, the people with boosted and vaccinated really do have mild illness. They're sick for a few days and then they come back. But the people who are not vaccinated, or the people who are vaccinated and not yet boosted, those are the people we're seeing getting quite sick and being hospitalized, and some of them dying. The other question we'd had as well, I already had COVID in the fall. Aren't I protected against Omicron? Well, previously we would have said yes. So if you were infected in 2020, you had pretty good protection against Alpha and Delta. If you got sick in the winter of 2020, 2021 with Alpha, you had pretty good protection against Delta. If you had Delta, you had very good protection against getting Delta. So previous protections worked. However, Omicron is different. So with the Omicron, previous infection with Alpha and Delta don't give you very much protection. The highest I've seen is 50% protection, but we've seen other predictions down as low as 20%. And we have seen a bunch of people who were sick, and really sometimes quite sick in August and September, now get it again and get quite sick again. So again, previous infection did help previously, but previous infection doesn't help you very much with Omicron. So that even if you've had a previous infection with Delta, I'd really suggest you go ahead and get a booster to go ahead and prevent you from getting the disease again. Another question that came up is, what about masks and mask mandates? Well, people have really, really gotten masks under their skin. I cannot tell you the number of emails that I get that are really nasty and bitter about masks. And masks are certainly not perfect. Anybody who claims that they're perfect and not wearing a mask is somehow you're right. It's very, very confusing. The point is that masks are somewhat helpful in decreasing disease. And so they're not perfect, but they're somewhat helpful in decreasing the disease. The better mask you wear, the better the protection. If you wear a very high quality mask very consistently, everybody else is wearing a mask, it really does decrease disease. And I think there are a number of very good studies that show that in areas where people are using high quality masks, that the risk of infection is low. And in fact, we know that in healthcare settings. We in healthcare settings see people with COVID all the time. And if you're in the emergency room, you're seeing them every day. And those people, by wearing masks, have had really quite good protection. When we've asked the people in healthcare who get sick, usually they're not getting sick from work, they're getting sick from the place at home. So masks, if you use high quality masks consistently, do work. If you use masks less and less well or less consistently, so the people who wear them as chin straps, are probably don't work very well at all. Or if you don't wear a mask at all, it doesn't work. So there's a gradation of protection. I don't think there's anybody who's going to say that you're guaranteed to get the disease if you don't wear a mask, or you're fully protected if you do get a mask, but there is a gradation of protection. I mean, we've used the Weatherman analogy too much, and it's sort of like, what coat are you going to wear when it rains? Well, if it's not very rainy, you might just wear a light jacket. If we're going to have an absolute blizzard, you probably wear a very heavy, very protective coat. And certainly that's what we should do with masks. So with the amount of disease we have now, it still makes sense, I think, for kids to wear a mask in school and for people to wear masks in crowded indoor situations. But if we get to a time in March and April where instead of they are averaging 90 cases a day, we're averaging, say, 9 cases a day, then it might make, then wearing masks would be a different calculus. Still would give you protection if you wore them, but the risk is lower. I mean, you could always wear your heavy coat all the time just in case there would be a snowstorm, but none of us do that, right? So you might then get to a point where you don't need masks. Oregon is going to come up with some guidance about masks. I have no input on that guidance, so I don't know what it's going to be. But I think it does make sense at this point to wear masks, and it does make sense at some point not to wear masks, and in some situations not to wear masks. So I think wearing a mask outdoors, probably not necessary at any time, and certainly not now. I think wearing a mask indoors in crowded situations, I think it's fine. If people want to wear masks for other reasons, I think that's fine too. But I think we're going to soon get to a point where we are not going to need to use masks, and that would be great. One of the other questions that came up was about the vaccines for the younger kids, and we touched on that a little bit. The vaccines for the younger kids is a little confusing because the studies that they did on the vaccines for little kids showed that there was no safety concerns, but also showed that they weren't that effective in preventing disease. So when the FDA and the ACIP is going to look at it this week, they are thinking that they might approve it with the third dose providing more protection. We really haven't done that with other vaccines, so we're going to really have to watch carefully to see what they say about that. So we'll get a chance to see. And then the last question that came up is, what about the side effects, the myocarditis and pericarditis that we've seen with the mRNA vaccines? No question that about one in, depending on the group, between 1 in 100,000, maybe 1 in a million people after they get the mRNA vaccine, typically more in younger males, typically more after the second dose, will get chest pain. And then when they get looked at, there'll be either some inflammation of the heart or inflammation of the heart lining. And they get this, many of those people get hospitalized because it's scary to have chest pain. And they typically get treated with over-the-counter, non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, and they almost all recover. So it's there. But what we've also seen this week is when you look at the data from people who have just COVID itself seems to be a real risk factor for myocarditis, pericarditis, and heart attacks. So if you say, well, I'm not going to get the vaccine because I don't want to get myocarditis, unless you have a way to prevent yourself from getting the disease itself, and right now it's pretty hard to prevent getting the disease except with vaccination, you're actually at a higher risk of getting the myocarditis or the pericarditis. So if you got myocarditis or pericarditis from the vaccine, but never got it from the disease, that would be a tough decision. But since you actually get more myocarditis, pericarditis, and heart disease from the disease than the vaccine, I think it's an easy decision that young people should go ahead and get the vaccine, and the mRNA vaccines seem to be, except for the myocarditis and pericarditis, quite safe and very effective. Well, that's all the questions we had for this week. Again, in recap, I think we've hit our Omicron peak. It's starting to come down. Hospitalizations are still a little higher than we'd like, and certainly the deaths are very worrisome. But overall, it looks like things are getting better. I would expect us to continue to go down over the next several weeks, and I would expect this springtime to be much better with lower case rates, loosening restrictions. The only caveat I put on that is that there easily could be a new variant that we're not expecting, but a new variant that comes out that could change all that. So again, like the weather, I predict really good weather for March or April, but I can't rule out the fact that there'd be some kind of freak, unpredictable storm. And just like that, the variants would be a freak, unpredictable storm. But pretty much, I think things are getting better now. And so just a few advice. One is, if you're sick, stay home. In so many of our outbreaks, somebody who is sick has continued to go to work, infected a bunch of other people. And although those other people, none of them have died, but a bunch of them gotten sick and it really have made it very hard. So if you're sick, please stay home. The second is, if you're sick and you have mild symptoms, you don't need to go out to get a test. A home test would suffice. If it's positive, you have it. If you do have COVID, either from a home test or from another test, or even just to think you have it because everybody else in your family does, stay home for at least 5 days. And then until your fever is gone, without Tylenol or ibuprofen, and you're starting to feel better. For most people, it's about a week or so that they need to stay home. And if you have questions, give us a call. Our hotline's still open, 541-464-6550. They're there every day from 8 until 5, and we'd be happy to take your questions. Again, this is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County, for February 10th, 2022. Thank you.